Hi parents, are contact lenses safe for children? This is one question we get asked very often, mostly by parents who have almost been forced to come to the clinic by their children who want to try lenses, usually young teens. So what I would like to say is that children can wear contact lenses, they are safe, but they have to be responsible. So whether a particular child is responsible or no is a decision that the parent can take, and probably there is no one better to do that. Why you have to be responsible? Because you can't sleep in them, you can't shower in them, and you have to take care of them, you have to clean them every night. In fact, some children are born with cataracts and we operate on those cataracts, and post the surgery we actually teach the mother to make that 1-month-old child wear contact lenses. So contact lens wearing is not really age dependent, and yes, they are safe for children as long as we take care of them. Another group of children that we see who are wearing contact lenses more often are children who play sports. Contact lenses in sports offers a few advantages. One is, of course, it increases the peripheral vision of the child. You don't have these obstructions of that the frame will have, and when the peripheral vision goes up, your reflexes or your ability to respond to a moving object like a ball or a soccer ball or a tennis ball, obviously the reflexes improve. The other thing with contact lenses in sports is they are stable. There is no risk of a contact lens falling off the eye. Of course it can happen, but the chances are not as common as you would think they are. Glasses, on the other hand, if you bang into somebody, can actually fall off your face. In fact, there are certain lenses today that are being made to reduce the speed of progression of myopia. So myopia is a condition in which you have a minus number. All of you who are watching this video or who may be interested in wearing contact lenses most likely have myopia. And what these special lenses do, they are called ortho-K lenses. What ortho-K lenses do is they have to be worn at night, and once you wear these lenses at night, they actually change the shape of the cornea, and when you get up in the morning you take out these lenses, and that child will actually be glass free for the rest of the day. Of course, the next night he has to again wear the lenses and go to sleep. So, coming to the first question, are contact lenses safe in children? Yes, they are safe, but you have to be careful and take precautions and know that there is only benefit in wearing contact lenses if we take care of all the precautions. Thank you for watching.